Hi, Emily.
Hi.
Doctors prescribed you some prednisone.
Yes.
Do you have any allergies?
Not that I know of.
Not that you know of. How about medical history? Have you had hypertension, diabetes, GI
no.
issues? Nothing?
Nope.
Okay. Alrighty. Well, then I'm going to go ahead and go over prednisone with you.
Okay.
The way it's going to work is it's going to decrease the inflammation caused by the poison ivy.
Okay.
It's going to reduce the inflammation, the swelling.
Mm-hmm.
It's going to make it less itchy because it's probably pretty itchy.
Yeah.
It's an oral pill that you're going to take.
Okay.
You can take it with any food. It's probably better to take it with food because it's going to upset your stomach. That's a side effect from the med. So be sure to know that you can do that. If you have any trouble swallowing because of a sore throat, anything like that, you feel free to crush it.
Okay.
To make it easier, applesauce pudding just mix it right in.
Okay.
The big thing with prednisone is they don't want you to stop taking it abruptly.
Okay.
So the way that they're going to do it is they've got the doses tapered down so that you can taper yourself off of them.
Okay.
You're going to start by taking it for 40 milligrams for 3 days.
Okay.
Then you're going to go to 30 milligrams for 3 days, 20 for 3 days, and 10 for 3 days.
Okay.
And then you can stop after that.
Okay. So even if I start to feel better halfway through, I just keep going?
Yeah, absolutely. Keep going. If your symptoms from the poison ivy don't go away, we want to know about that.
Okay.
So be sure to let us know how things are going.
Okay.
You know. Prednisone has a lot of side effects, so I'm just going to go over a few with you.
Okay.
I'm going to highlight as we go.
Okay.
Let you know the real common ones, and that way you'll have this list to, kind of assess every so often. Yeah. Big thing with it is nausea, like I said. Hypertension, depression, you're just kind of feeling down and out. That's pretty common. Weight gain is another big thing. Okay. So be sure to know that that's normal. Okay. It's going to go away after you stop taking the meds. Okay. Side effects we really want your doctor to know about are going to be the cause of, or they will cause adrenal insufficiency, and that's huge with prednisone, and that's why we want you to taper yourself off of it. Okay. Those symptoms are anorexia, nausea, weakness, and fatigue. So if you're not wanting to eat anything, you don't feel like you're hungry, makes you sick to your stomach, you're feeling just real yucky, real gross with the fatigue, and it's also could make you short of breath. Oh, okay. Hypotensive, low blood pressure, and hypoglycemic, so low blood sugar as well. You said you're not you're not diabetic, so that's really good. Okay. Like I said, if you stop taking it abruptly, could cause adrenal insufficiency, so let us know. Okay. Severe abdominal pain and black tarry stools is another thing for GI distress we want to know about. Okay. Prednisone has a lot of drug-drug interactions, so if you start taking something new, call us, let your doctor know, or the pharmacy. Check with both of them so that they can let you know that if it's compatible or not. You don't want any reactions that you're not wanting. Okay. Also, you said earlier that you're not pregnant. Prednisone's category C, so there's risks involved if you were. So if you get pregnant before you stop taking it, you need to let us know again so we can weigh pros and cons. Okay. Also, the last big thing with prednisone is since they're so conscious about the dosages, they don't want you to double dose. Okay. So if you forget one day, which is, common, it'll happen, then don't take it when you remember unless it's really close to your next dose. Okay. And if you do that, then just throw that dose. Well, don't throw it out, but don't take it. Okay. And then just restart that next dose. Okay. So, will you go through some of the things? Can you tell me about the doses that I told you about?
Yeah, you said that I'm not supposed to stop it abruptly, so start at 40 milligrams for 3 days, and then go down to 30, and then 20, and then 10, and take all those for 3 days. And then that I'm supposed to report to my doctor about if I'm not feeling good, not wanting to eat, if I have any abdominal pain or a black stool. Right. And then also ask him if I want to take any over-the-counter meds or talk to my pharmacist because there's a lot of interactions. And then that I shouldn't double my doses if I forget to take one.
Right.
Okay.
Very good.
Yeah.
Well, good luck with your poison ivy.
Thank you.
Bad news. Yeah.
Yes, thanks.